Yes.
Will we go ahead?
Oh, yes, Sharif.
Namaste. Namaste. Hope you're all doing well. And I welcome each one of you for this virtual conference. Oh,
I'm sure you're all going through the same hassles in your practices. Now, it's going to be very difficult for all of us to face children in our clinical practice. Children are afraid to come out of their houses, and children are afraid to see anybody else. And I'm sure each one of us in every country will face the same issue when we handle the children. I hereby welcome everyone for this virtual conference of International Association of Pediatric Dentistry. And this is a very novel way of learning things and participating in such a wonderful meet about pediatric dental practitioners across the country. I am very glad to introduce Dr. Varinder Goyal. He is a very close friend of mine, and we all hail from India. And now I know you are very comfortable with the mask, Dr. Varinder Goyal.
Yes.
Dr. Varinder Goyal is a professor and chair of the Department of Pediatric Dentistry, Guru Nanak Dev Dental College and Research Institute, Sunam, India. He is a member of Educational Committee of IAPD, and he is the president of South Asian Association of Pediatric Dentistry, and he's a very, very active member of Educational Society of Educational Educational Committee of IAPD. Not many people are aware of Dr. Varinder Goyal's achievement. When IAPD conceptualized about having a virtual conference, he was one of the first people to introduce the boards about the virtual conferencing platforms like Zoom. So, which is what we are going to use all through the conference, and we've been very successful in using it. I thank Dr. Goyal for his hard efforts to conceptualize the virtual conference of IAPD, and it has paved a way of a new way of participation of these conferences. Incidentally, he was my predecessor as far as president of presidency of Indian Association of Pediatric Dentistry, because I was incumbent president after Dr. Goyal's office, and he did a lot of hand holding for me, and he made my presidentship very comfortable. Thank you very much, Dr. Goyal, about this. Dr. Goyal is also a member of Faculty of Dental Surgery, Royal College of Physicians and Surgeons, Glasgow, and he has many, many feathers on his cap. He is a member of many professional organizations like American Dental Association, American Association of Pediatric Dentistry, European Association of Pediatric Dentistry, and International Association of Dental Research, and many more. He has over 50 publications which are indexed in international and national journals. And I'm very, very glad to present Dr. Varinder Goyal. Dr. Goyal, the screen is all yours.
Thank you so much, Dr. Srinivas, Namineni, for this wonderful introduction. Dr. Namineni, no doubt, is a great friend of mine. Apart from that, the best thing about him is he loves behavior management techniques. And he is popularly known as Gas Man in India, because he is the person who has really worked hard, and he made sure that our National Dental Council adopt nitrous oxide sedation into their curriculum. And he has done a lot of work in this field. He has taught almost, I think, most of the postgraduates who are practicing nitrous oxide sedation today in India, and maybe many of the Asian countries. I must congratulate him and I must appreciate him on this platform. And nothing can be better than sharing a dais with a person who is so learned, so humble, so amazing. Thank you, Dr. Srinivas, for being with
Thank you.
me on this amazing platform, amazing virtual congress of IAPD.
Thank you.
Today, we are going to talk about few of the old age techniques of behavior uh, management. Apart from that, we are going to talk about how things have become different for us because of this pandemic. That's all we are going to discuss one by one. Before I start my presentation, I would like to convey my words of gratitude to Professor Marcelo, Professor Dr. Ari, who, because of whom I am there in this today's platform. Thank you so much, Marcelo. Thank you so much, Ari. Because of Dr. Anna, I'm into IAPD Education Board. Thank you so much, Dr. Anna, for that. I must convey my words of thanks to Figain, who is my chair of my education committee. She has always supported. Thank you so much for all the support. Thank you, Dr. Weekle, for wonderfully reviewing all the uh, poster abstracts which were there, because I know I was closely associated with the people from India who all have submitted the abstract to you. I could, and I could find how beautifully you have reviewed each and every abstract which was submitted to IAPD Virtual Congress. Thank you so much, Young, for always being there, for being so lovable. Uh, in regards to Dr. Norman, James, thank you so much. Thank you all. And I would also like to convey gratitude to these two important people who have really worked hard for this conference, particularly for this virtual congress, that is Dafna and Loran. I was always in touch with them whenever we had any issue and some registration issue. People were not able to log in or they were not getting reply. So immediately I used to get the feedback and everything used to be settled down immediately. Thank you so much, Dafna, for that. And Loren, thank you for always being there, so supportive. Uh, Rather, we are in touch since I became the member of the education committee. We have interacted almost every week and maybe multiple times in a week. And every time it was amazing. Thank you so much. This is one beautiful line uh, which was quoted in 1895, that although the operative dentistry may be perfect, but the appointment is a failure if your child patient departs in tear. And this is the one beautiful book which is authored by our own General Secretary of IPD, Dr. Ari, apart from Dr. Wright. Uh, I recommend this book. We must go through this book and learn about behavior management techniques in pediatric dentistry. Whenever we treat a child patient, we should not treat only the tooth. Rather, we should treat the child as a whole, as a package. So that is important. We are not going to treat only the disease, whatever the disease the child is having. We need to treat the child as a whole, so that we can instill a positive behavior in that child for future. This is very, very important. Every pediatric dentist expect their child patients to be like that, but this is not the case. The reality is entirely different, and you all will agree that 64 to 70% of your child patients have some kind of anxiety or some kind of fear. And behavior is basically whatever behavior we show, whatever the behavior a child patient shows into your practice, that is their inability to cope with the anxiety, because every person has a coping abilities. If the coping abilities cannot handle that anxiety, the child doesn't behave well into your practice. And what we do with behavior management techniques, that is, we instill appropriate coping strategies in the kids. And that is only possible if you have empathy, you have a great communication skills. That is important for every pediatric dentist. So behavior management may not be only the science, it could be the art. So it is basically science and art, it is not only the science. So this is one topic, a beautiful topic on dental behavior management problem and the role of child personal characteristics. According to that, the behavior could be because of the anxiety, because of the past negative experience, which may be related to the medical treatment or the dental treatment, whatever the case is. Then it could be because of a different parenting style, parental anxiety more than maternal anxiety, or the caretaker anxiety, because whatever their past experience about the dental treatment or the medical treatment is, they can transfer the same kind of experience to the kids. Then if the kids are aware of their dental problem, they know they are going to have some dental problem or they need to go for some extraction, that also adds up to the anxiety of the children or fear of the children. Then it is the culture, because every people, every society, every country has a different culture, every person has a different culture. So that also adds up to the anxiety of the patient. Then the temperament, this is also a very very important factor as far as the anxiety of the child patient is concerned. This is another beautiful article, and this is a suggested reading. We all must go through these articles. Now, this is the reality of today's, that we are all suffering from pandemic because of the COVID-19. And if we go with the data, this is the latest data by WHO. This was taken yesterday night at about 5:30 or around 10 o'clock as per the Indian time. And you can see that 29 million people are affected because of COVID. And you can also see that 930,000 deaths has already been reported to WHO. This number may be more. This is what it has been reported to the WHO. Now, this is what we used to do in the past. You can see there is no gloves, no protection, nothing. No mask were needed. But now this is not possible. We need to change our ways of practice. Now, for the behavior management, there is an important role of the dentist. These are the factors like attitude of the dentist, body language of the dentist, communication skill of the dentist. If I look at all these factors, now the most important in this COVID period will be your body language, your communication skill. Because the personality of the dentist may not be very, very effective tool now, because we are all covered by face shield, we are all covered by PPs, the mask, even your head cap. But the important will be your body language, your communication skill. Time and length of the appointment is okay. Your skill is also very important. How fast you do the treatment, that is also important. How much attentive you are to the patient. Yesterday night and even before that, I was attending the lectures which has already been delivered by our honorable speakers. I attended Andrea's Amar Morsi, because I could find what all those speakers have discussed, and accordingly I changed my presentation in the last slide only, because I didn't wanted to repeat things again and again. If you if according to Dr. Andreas, he has rightly said that attention to the patient is very very important. We cannot attend to our phone calls, we cannot watch our social media on the phone when we are with the patient. We have to be attentive to the patient. Patient should feel that he is very very important for the dentist. So communication, body language, time and length of appointment, your skill and speed, and attention to the patient is very, very important. So we have to be an active listener. This is important. You have to listen to the child patient as well as parents, that what are their demands, what are their expectations. If you are active listener, you can find out many things about parents and about the kid, about the child patients. If you listen to the parents as well as children, you can find out how afraid the child is, how terrified the child is. Unless you do not have the capacity to listen, if you do not have the capacity to be attentive while conversing with the patient as well as the parents, you may miss out many, many important things. So, in communication, the dialogue delivery is very, very important. Your tone of voice is very, very important. Facial expression is very, very important. Body language is important. But facial expressions, unfortunately, may not be the tool in this pandemic, because your face are covered. But as Dr. Andreas said in his lecture, the truthful smile is very, very important. Even if your face is covered with your face mask, or with a mask, half face respirators, still the patient can see your eyes through the even the face shield. So if your smile is truthful, the patient, the parents will appreciate your smile. So four ingredients in communication are important. One is you, who is the sender. Then your the message, how this message has been delivered using best of the facial expressions and the best of the body language, and the setting in which the message has been sent. The message has been sent in a comfortable room, in a pleasant with the pleasant colors, pleasant surroundings. Your room may not be well decorated. Decoration is not important. It is the ambience is important. How nice, how what is the fragrance in the room, that is important. Because sometimes what happens, we have a typical eugenol smell into our practice, which may not be soothing for the child patient or even with the parents. So setting in which the message is sent is very, very important. And the receiver, if the parents and the patient is not able to receive your message, that your purpose will not be solved. So the receiver should be able to receive whatever you want to communicate with that, the receiver. That is important. And that is only possible if you have given uh, right time and you have known about that receiver, that is patient as well as the parents. Because if you do not know their socioeconomical status, if you do not their language barriers, if you do not know how much and what kind of information they can receive, there is no point. You have to use simple words which are customized according to that receiver. That is important. Your truthfulness is very, very important, because if you are not truthful, then the trust will not be built up. Because this is one a beautiful cartoon. You're If you are not truthful in explaining to the patient as well as the parents, then the child patient will never ever trust you. So if you're going to give an injection, and if you say no, it won't pain you, this doesn't make sense, because we all know injection is going to pain you. If so, that's the reason you have to be truthful. That is important. So for the assessment of the patient, these are the points which are important to know. One is the cognitive level, cognitive development. To know about that is important. Temperament we have already discussed. Anxiety and fear we have already discussed. That is important to know. How the child reacts to the strangers. This is also important to know. What was his behavior at his previous medical and dental visit? That was also important. Because if you know it was a good experience or bad experience, accordingly you can modify your behavior management techniques. You must ask the parents that how they anticipate the child to respond to your future dental treatment. That is also very, very important. And you can evaluate the cooperative potential of the parents as well as the patient by interviewing those patients. To know more about the patient, you can send pre-appointment letters. That could be in the form of a hard copy by post. It could be in the form of WhatsApp message. It could be in the form of an email. It could be using Insta. So many social medias are available to communicate with the patient. But most of the patients do not prefer phone calls, direct phone calls. It's not that they don't prefer, but most of the patients do not want the phone calls. So it's always important that you must use social media, not the phone calls, to communicate with the patients. That is important. So in your pre-appointment letters, you can mention few points that you must not talk to the child patient about your own anxiety, because if you share your own anxiety, the child will be more anxious. And whenever suppose the parents are not able to come to your practice, so if they are sending some guardian with the patient, then the guardian should not be anxious. That is important, right? So patient the parents should be encouraging toward the child patient. They should not use dentistry as punishment, because otherwise this will add up into the anxiety of the child patient. They should not use threatening words like pain, discomfort. These should not be used to the child patient, because then he anticipate that something painful is going to happen. So for this purpose, for knowing about the child patient, about the parents even, there are two ways. Either you can ask the parents to fill up a form which you can send it to them by various modes, or you can have a direct interview with child and parents. But in this COVID, direct interview may not be possible, because you don't want number of exposures with the patient as well as the parents. You want to avoid. So there are ways now. You can do a video call as per the convenient time of the parents, and in that video call you can discuss about all these points which we just discussed before. So there are few books available. These are the references, these are the sources from which these books are available. And these books will instill a positive behavior in the kid, because everything is detailed in a very, very simple way. So this one is one of the example of the letter, pre-appointment letter, which can be sent to the parents. This was shared with me by Dr. Antonio. He is from Belgium. He's a great friend of mine. And this is a pre-appointment book. This is the pre-first appointment book, in which this book is designed by him. So the kids can see what all simple procedures are happening in a very, very simple way. All cartoon characters are there. And he has given this cartoon character as the name of a rugi. It is a tooth. So this is a beautiful book. So kids love to see and those books. And then now, since because of this pandemic, you don't want that book should be shared with all the patients. So it's better to change from the book to the phone as well as the iPad. This iPad may not be of yours, may not be into the practice. This iPad, you can share the pre-first appointment film. You can send it by email, or you can send it by WhatsApp, and the patients and the parents can see the film at their own convenience. This is one of the poster which was made by Dr. Ajit, and it was designed by, this poem was written by Dr. Amanda, and it was published in BDJ. And this is a beautiful poster which can be sent to the patient and the parents. Like, this is how your dentist is going to look now. And this is a picture which was shared with me by Dr. Mora. She is from Brazil, in which she is doing a video call. And in this video call, apart from giving oral hygiene instructions like brushing or the diet counseling, she is able to know like what all what is the behavior, what is the experience of the patient, and what is the expectations of the parents, what is the economical status of the parents, how well they are able to understand your commands and all that. And then comes your waiting room. Now I'll come down to the clinic portion, like what all changes we need to do because of this pandemic, and what all we can do in behavior management techniques. There is a lot of change into your practice now. A lot of modernization has come up. The clinic should be bright colored, because all love colors, especially the kids, they love these kind of colors. There could be a music which could be family oriented or the kid oriented, depending upon to what age you cater. Because if you cater to say from birth to 18 years, you cannot have only the rhymes and all that. So it could be the mixture of both, because if you play music which is for only for the very young kids, and if a 15-year-old child is coming to your practice, he may not like this kind of ambience. So accordingly, whatever your orientation of practice is, you can choose your music, and then you can put children targeted activities into the waiting hall. But those activities has to be limited now. You cannot put all kind of soft toys or all those, because of you don't want cross infection to happen. So whatever toy which you can disinfect, that is important to be kept in the clinic. And apart from that, what important is lots of sincere and smiling faces. So your receptionist, your dental hygienist, your staff, and you yourself is important, because all smiling faces are always welcomed by everyone. In waiting area, important thing is you should not entertain the child. You should just draw the attention. That is important, because if you start playing education videos into the dental operatory, the child will know that some dental procedure is going to happen now. So do not play dental education videos in the waiting hall. But only thing is, you just have to draw his attention, you have to divert his attention. And another important thing is, before that, these are few of the examples which you can keep into your operatory, but all these should be disinfectable. If you cannot, then you cannot place all these things into your operatory. Like if you can see a child using a drawing book, so preferably this book should be brought by the parents, or it should be fresh. You cannot give the same book to your future patients. And if you are giving a small toys to play, these toys should be disinfectable and cleanable. That is important. So that's how we need to change our waiting area. Now, another important thing is the children need to conserve their coping skills in the waiting area. That is important, because everyone has a limited supply of coping skills. So if you minimize the need for child to use coping skill in the waiting area, the same coping skill can be used by the patient to manage when they are undergoing the treatment, right? So you need to capture their attention. That is important. So you can use carry-ons, coloring books which are taught by parents. You can play some interactive games, but whatever uh, games or any gadget which you place should be cleanable. It should not be a source of infection. And another important thing is use of headphones. You should place headphones, because there could be a child patient who is crying, right? But if an old patient is coming to your practice and he is wearing a headphone and listening to some music, then it doesn't bother to him. And same could be true for the younger kids also. But headphones may or may not be cleanable. That is important. But we can choose those kind of materials which we can clean after every patient. And another important thing when you capture the attention of the patient or the child patient is that you give time for the mother to have a break. And if the mother have a break and she is relaxed, then she can actually help you also during the treatment part. That is important. Now there are a few behavior management techniques which are there, and top 5 are very commonly used into our practice. Now the use of nitrous oxide and oxygen inhalation is a lot. because now it is taught into every dental school. I'll give you the data. There is one slide which is coming up very soon. We'll discuss about this there. These are the few advanced behavior management techniques like protective stabilization, sedation, and general anesthesia. But I am a person who loves managing kids with non-pharmacological behavior management techniques. So this is one study in which they have they have researched about what all behavior management techniques are used in what percentage, depending upon how many years they are working into and they are practicing. This is in general. You can see on your slide. Tell show do is still the topmost, still the topmost. Then comes your nitrous oxide. These are the techniques which are used by most of the dentists now. That is the American based research. And this data shows, if you look at this data, still, even after 30 years of practice, people prefer to use tell show do technique. But the nitrous oxide use has increased recently because the pediatric dentists who are in practice from 1 to 5 years, they are using more than pediatric dentists who are 30 years back. So this has happened because the parents want their child to be comfortable. Their expectations are high because they know that if you use these kind of techniques, the child will have a positive dental experience. And another is media. A lot of information is available about various behavior management techniques. So the parents prefer now nitrous oxide sedation apart from TSD, which and TSD is there, modeling is there, reinforcement is there, desensitization is there. Those techniques are still the gold standard, but now lots of sedation, general anesthesia, as well as the nitrous oxide sedation is coming into use. This is one again book which I will recommend all of you to read about behavior management techniques. This is a beautiful research. In this, you can very well see that the parents still prefer GA or sedation over active or passive restraints. Hand over mouth is certainly not into use now. Many of the countries are not recommending now to use hand over mouth technique, even the voice control technique. The parents prefer that their child should be put into sedation and do the treatment rather than using the aggressive kind of treatment. This is another article in which it is well documented that there is a very, very low parental tolerance for the firm management techniques. They do not want the kids to be put to the firm management techniques. There is an important role of the parents into behavior management technique, that if the parents are apprehensive, the kid will be apprehensive. Few parents have an attitude that the child has to behave, he has to behave, no option in that. But now, over few years, over last 10 to 20 years, the attitude of the parents, the temperament of the parents are changing. The parents are more involved and they want that we should remain with the child patient during the treatment. And in the past, it used to recommend that for the young patients, very young patients, it's okay that we can allow the parents to be with the kids. But for the older kids, it was not recommended. But now the things have changed. The parents want to involve themselves in planning, but it's good also that the parents can help you if they are passive. They should not be actively involved. They should not be talking to the parents, patient continuously. That is important. And this already, I think we have discussed. This is a few of the articles which you can refer. Now, this is the latest research, I'll say, not very, very latest, but still, because not many randomized clinical trials are there, especially in the behavior management technique. simple clinical trials are there, and few of the guidelines are there according, because in behavior management techniques, unfortunately, a lot of clinical research is not there. A lot of clinical research is not there. But since it is the more of researches of or their own experiences of clinicians and pediatric dentists. So depending upon that, there are guidelines. Now the patients prefer to be present into the operatory, and this trend has increased in most of the countries and cultures. But if you want to have absence of the parents from the patient during the dental treatment, it is important that we should discuss it beforehand, that why you want their absence to be there, and then only it should be implemented. Then next is the gold standard tell, show, do technique. This technique helps in introducing your dentistry to the kid in a stepwise fashion, and this is still the most common management technique used into pediatric practice. This is what we used to do before. We used to show the child like this is how the treatment will be done, and exactly the way we used to tell the child and show the child, we used to do the treatment. But now, because of this pandemic, we cannot do like that. So here you can see the kid is doing treatment. Whatever the dentist has told him, he is doing himself on, but this toy was not provided by the dentist. All these instruments, all these toys were brought by the parents. That is important, because you don't want cross infection to happen to the next patient. This is another beautiful article on this. And you can, this is a puppet with a plastic teeth, and the child is doing a treatment on patient, whatever the treatment has to be done on him. This is another where you can see a light cure gun is being used on her doll. This doll was brought by the parents. Same treatment is given to the child patient. This is another change from tell, should uh, do is tell, play, do, because then we allow the child to play with dental instruments, because these are the bigger toys. You can easily disinfect these toys, so it is not a problem. Only thing is, you may need to have one or two sets, so that in the meantime you can sanitize, you can disinfect the one set, and you can allow the child to use the another set. This is one of the study for tell, show, play. Then we have the modeling. This is a standard, gold standard behavior management technique for managing children into your dental practice, in which either a live model we can use or a film model we can use. But because of this pandemic, you cannot have the live models, because it is important that whosoever is in operatory should be well protected with PPE, personal protective equipment, even the parents. So that's the reason it is important that we cannot allow the live models to happen now. Maybe the things will be fine, and again the live model will be helpful, but now film models are important. That is important. So this is one article in which they have used the video modeling, because if the child patient is anxious child patient, then whosoever is doing the modeling should show his anxiety, same kind of anxiety, and get the treatment done, and at the end of the day should leave happily with a positive reinforcement, maybe with the help of some gift or something. So sorry, this is what is the video modeling. The dentist is showing the video, but we cannot show the live modeling. Then we have a distraction. Distraction is a very useful tool in behavior management, that you want to distract the child from whatever the current situation is, that is your dental treatment, and you want to focus the child's attention to one single thing, that is whatever the video content he is enjoying, and this will motivate the child to come back and for another show of your presentation or the video. So there are various ways of distraction. This is VR, virtual reality. But if same virtual reality is used by next patient, there are chances of cross infection. So for audio visual distraction, this is important that you ask the parents to bring their own iPad or mobile phone in which the child can watch the any film or cartoon film, whatever their liking is. That is important. These are the few of the articles in which they have discussed the excellent role of audiovisual distraction in the management of anxiety and in the management of pain. It could be in the form of cartoon films, audio tapes, or you dentists yourself who can talk continuously and divert the attention of the child patient. Then we have a video game distraction. This video article was not for dentistry. This was for promoting good oral hygiene and good healthy diet. And that was particularly for the high risk patients because they have used a few of the video games which are related with the brushing and with the diet control and all that. And then we have mobile dental app. There is only one study I could find into the literature. According to this study, this is one video game which has been developed by Tenolgix company, and app name is My Little Dentist, in which the cartoon character is actually doing the treatment. Even he's doing the extraction, restoration, and scaling, and all that. And the child behaves like that he is doing the treatment. And it was found to be very, very successful that 86.6% of the patient turn from negative to positive behavior, and we can use dental app for that. So this is a virtual reality. Many articles have supported the use of virtual reality, but we cannot use virtual reality unless it belongs to the parents, because it is not possible to disinfect these virtual reality equipments. Even for giving injection, if the child is engaged in virtual reality, the child doesn't feel pain. Then we have smartphone dental simulation games. These can be used to reduce anxiety of the patient, and this was the study, and it was found to be very, very successful. Then we have a reinforcement. This is also a gold standard, one of the option in behavior management, in which you give something. It may be of some value. It could be your even it could be the non-materialistic in the form of your own words, that is which helps in positively reinforcing the behavior of the child. Like you can see, the toys were given. This is one of us, a reinforcement that you're appreciating, you're talking to the child. But now, because of pandemic, you cannot give these kind of toys to the kids. Now you have a different way of giving positive reinforcers to the kids. If at all you want to give some toys, you have to wrap it. What we practice into our practice is, we have a box of toys, and the child is free to choose one toy from his choice. But now that cannot be done. We cannot give an open box of full of toys. So one toy we can give, which is a wrapped one, so that there is minimum chances of cross infection. Now the world is closed, we all know things are changing. Your offices are changing, your uh, PP is changing, your mask is changing, everything is changing. Now every kid who is traveling, who is going to school, or who is even at home going to market, they all have to wear the mask. So mask is a new normal for every kid. They are not very scared. But innovations can make these face shields and masks beautiful. This one, uh, these pictures were shared with me from my friend from Jordan, Dr. Carmen Hather. So these are the pics. You can see how beautifully she has made these face shields and face mask and even the head cap. And this is one PPE which she has kept, on which every child patient will draw something, and she makes sure that she gives sanitized color pens for drawing on her PPE suit. Now you can see like how change is there because of this pandemic. You cannot give the twice to the child. Only your words of appreciation could be the positive reinforce. Your body language could be the positive reinforcer for the kid. And this is how you can make change into your PPE. Like you can attract the kids by using these kind of PPs. Now you can see the face shield. This face shield has been modified for the kid patient, and they believe me, they simply love it. And now you can this is one of the beautiful picture which attracted me when I was searching on Google about various types of PPE kits. This is one of the cartoon character which is there, and these nurses are from Philippines, and they have designed according to this, and the kids really love these kind of changes and these kind of dresses. So this is another picture in which beautiful face shields are there, modified face shields are there, and these are biodegradable. You can clean it and you can change it, and you can see how happy the kid is after getting the treatment. And this is one of the face shield which is uh, this is a very popular Indian film, that is Bahubali. It has two parts, Bahubali 1 and part 2. So this was this face shield is because of this, because this character is from this film. This is another modification you can do. You can, because your face is covered, you can put your photographs on your PP kit and let the kid and the parents see you. This is another virtual tool which you can practice, which you can design for yourself. We can see, we can mount a ceiling screen on which you can play any kind of video or any kind of uh, content onto the screen which the child can see. Dr. Antonio has actually made a beautiful cartoon film with all dental procedures. So whatever the dental procedure is going on child's mouth, the same procedure is played onto the screen so that the child know what is going to happen. So this is what he has done. It's a beautifully done. I really appreciate it. So in the end, we need to guide our parents and patients to become true believers of our practice. It is important that how efficiently we appoint their we do the appointment, how efficiently and how comfortably and how according to them we schedule their appointment, how warmly you welcome them, how what are the how comfortable you make them when they are into your practice, when they are into waiting hall, waiting room, how you engage the kids, how you engage the parents, that is important. When the child is onto your dental chair, how comfortable the child is, how safe the parents feel their child is, that is important. And when the treatment is finished, how you communicate the post treatment summary, that is also important. And when the child goes back, if any issue is there, any concern is there, how you manage, that is also important. And that is all possible because this is not cannot be done by the dentist alone. This has to be a teamwork. The patient should appreciate that real happy people work at your practice. That is important. And they should believe you, they should have a trust that you love doing, truly love doing for them, and you care for them. That is important. So the practice should be family oriented. It should not be only for the kids, not only for the young kids, because when the children grow up, then sometimes they don't feel coming back to your practice. They feel it is too juvenile. It is too for only for the young patients. So I need to go to some dentist who manage the teenagers. So your ambience should be family oriented, not for very, very young patients. Sorry. There are a lot of behavior management techniques which are available, but we need to consider using these behavior management techniques specifically for that particular patient, keeping in mind their cognitive development, parents' expectations, their cultures, their philosophy, and especially the legality. That is also important because wherever you practice, you have certain legal bindings. So that is important. But our main goal is to instill a positive behavior in the kid, and we need to give best of possible dental care for the children. So thank you for your patience learning. And again, I am really thankful to the board of directors of IAPD for giving me opportunity to be here to present myself. It was an amazing experience, amazing experience. Dr. Shri, please.
Thank you very much, Dr. Goyal. And now, when we all were back to work, we were all kind of confused of how do we face the child. And I think you have answered many of our concerns. And I'm sure the dentists who are yet to get back to practice will have a lot of messages to take home. And this is a very, very difficult times for the children because they don't see you, they don't see your face, they don't see you smiling, they don't know whether you are a friend or a foe, and the communication which is through your face is totally missing. I know we need to put a little more effort to face these children to make their lives comfortable in our dental practices. So this is an additional burden on us, and I'm sure we're all going to be well prepared after this lecture. Thank you very much, Dr. Goyal. Thank you very much.
Thank you.
We have a few questions. One of them being, as we were mentioning, with the PPE, it's very difficult to express our facial expressions to the patients directly. How can we cope with this situation? Partly you have answered. Is there anything else you want to add more than what you have spoken?
What we have now is into our hand is your smile, truthful smile. Second is your voice. And third will be your body language. Because truthful smiles can always be appreciated. Your voice tone, your communication skills, that is always with you. Your face expression may not be there, but smile will always be there. Your eyes can speak a lot. So your smile, your communication skill, and your body language, these should be your three main armamentarium in communicating with the child patient, in managing the child patient.
Thank you very much. There were a lot of appreciations. I think there's so many appreciations across the world that that shows your popularity across the world.
Thank you so much.
And there is yet another question. It says, with the children attached to mobile phones for such a long time in terms of their education, will the screen time have any effect on child's behavior in dental clinic?
Shiri, not into the dental clinic only. The child behavior and even the parents' behavior is different. There is one study which was done in China. I'm not able to quote you right now, but if you do PubMed searching on the PubMed, you will find one beautiful study on how this COVID-19 has affected the behavior of the children as well as the parents. There is certainly a significant change into the behavior of the child patients as well as the parents, because they were home, they did not attend the schools, they were attending only the online classes. So screen time has certainly increased for everyone. Even for us, the screen time has really increased because we never attended or delivered so many lectures in the past. What we have done after April. So I don't have certificate of attendance of the webinars. That number I don't have. What number I have right now? I may be having around 60 certificates with me, but in total professional life of 25 years, I may not have even 30. Right. So this
I
is
still
certainly
remember.
the screen
I
time
still
is
remember your presentation. I'm sorry. I'm sorry.
the screen time has certainly increased and it has affected. The only thing is the main role is of the parents now, because they have to relieve the anxiety of the children. That is important, and they are the only responsible for this. They can only help them. They have to listen to them, they have to answer to them, they have to spend a lot of time with them, then spending the time with their own phones and the virtual things. That is important.
Yeah, I still remember your talk, the first talk. You are probably one of the first lectures I have heard about how to get back to work about COVID pandemic. I'm
Yes.
sure a lot of IAPD members have attended to that talk. The time came later. We all have adopted many of those suggestions and guidelines which you have discussed about. I have one more question. The question is, how do we address these changes for special healthcare needs patients during COVID time? I know that this is little, a broader question. The general rules definitely apply in specific to special healthcare. Do you have any additional advisors when you have to handle special care needs?
Yes. Whenever you have a child who is in special needs, first of all, the treatment depends. Actually, it varies what kind of systemic issue the child is having, because your treatment plan will vary accordingly, because it's difficult to manage the children with special needs by using the standardized behavior management techniques. You have to use pharmacological behavior management techniques more often, and there is no contraindication of using those techniques uh, in in case of special children, except that if they require hospitalization, it should be safe for them, because as far as possible, visit to hospital should be avoided during this pandemic. But if at all any of the pharmacological behavior management technique is needed for these kids, it is not at all contraindication, not at all contraindication. And especially Shiri, as far as your nitrous oxide, for which you are born, I think, because you are the only gas man of India, and we can use nitrous oxide even in pandemic period, because ultimately the gas is going to be discharged out because of scavengers, right? So we can use nitrous oxide even. Only thing is the tubings which we use has to be sterilized, autoclaved, or disposable one. That is important, nothing else.
Right. I think we're running short of time. Thank you very much, Dr. Goyal. I'm sure many members would want to ask many other questions. I think they will contact you in person, and I think you'll be bombarded with a lot of questions in the next few days.
Oh,
And
yes.
I'm sure you have that much of patience to answer each one of those questions. Thank you very much, and I appreciate your effort of giving this talk to participants across the world. Thank you very much, Dr. Goyal. And
Thank
I
you.
also thank each one of the participants across the world. And I'm sure you all have something to take home. And be safe and safeguard your patients and your family, and take care.
Thank you so much. Thank you. Namaskar. Thank you.